We're going to look at the pelvis and the sacroiliac joint and try to sum up some different ways to address things like pelvic rotations and pelvic upslips that can be painful and cause weakness and dysfunction in many people. So the first thing we're going to talk about, when the pelvis gets out of alignment, you have a leg length discrepancy. One leg may be longer than the other, but with your pelvis being out of alignment, many people have success in treating their pain and their weakness by maintaining their pelvic alignment on their own outside of therapy and then after they've been discharged. So we're going to talk about a pelvic rotation. The first one, if someone has a rotation, the way that we would address that first would be to decide how it's rotated. So first thing we'll check is the leg length. So for Simone, I'm going to have her do just a bridge really quick. The bridge just kind of sets the hips in a midline position, and then we bring the legs down straight. So if she's doing this on her own, she would do is bring her feet together and kind of peek down at the tops of her shoes to see if one leg is longer than the other. We can see that her right leg is a little longer, but she can see from up there. So I try to include the patients as much as possible in seeing this so that they can learn it as they go and self-treat. With her legs being this way, right leg is longer, left leg is shorter. We're gonna figure out why. Having the patient learn this is sometimes easy and sometimes not. Some people cannot find where their pelvis is. So feeling the front of their pelvis and trying to decide if one side is higher than the other. This is in a patient who we know has equal leg lengths, not someone who maybe has a longer leg from childhood the way it grew. This is someone whose pelvis is just uneven, and because the leg's attached to the pelvis, it takes the leg where it goes. In Simone's case, her right leg is longer. I'd like for Simone to try to figure it out. The way I would have her do it is kind of feel for the bony, pointy part on the front of her pelvis right here. And I try to take her thumbs and kind of find those spots to see if one side's higher than the other. The left side is higher over here and her left leg is shorter. So when the leg is shorter and the pelvis is higher, I point to the direction that they went. The foot went that way, the pelvis went that way. So they both went in the same direction. So we have what's called a pelvic upslip. The correction for that is one of two things. One could be a friend or family member that's been trained here in therapy. We'll have them come in and learn how to do it. Do a gentle pull on the leg. We're not yanking on the leg. We're not trying to dislocate any hips or pull too hard. We're able to pull just hard enough to get the pelvis back to level. We can do it one of two ways. I can have her bend this knee and put her foot and kind of stabilize that way. That does work for many people, and that way the person who's helping can give like a gentle pull here and then their hands are free. Personally, I like to do it a little different because I feel like I get a little bit better stabilization because you have to stabilize the opposite side of the pelvis to get this side to pull down. I would sit down for it, and I always just grab a towel because we don't know where that shoe's been, on the ground outside somewhere. So I would stabilize here just to check to make sure that they feel okay with me grabbing their ankle there and pulling. Some people might have a sensitive ankle, so I'm gonna stabilize here, my elbows against my body, and then the other side I'm just gonna give it some tension and just kind of pull on it. And I move it up and down, and that's just gonna give it enough traction to correct the upslip on that side. Patients often ask, how could I fix this myself? What we do is have the patient stand up. We're going to walk over to a step and we're going to show you a technique by the step. Okay, so for the correction of the left pelvic upslip for Simone, we're going to show the standing technique. For her, her left leg was shorter and we found that her pelvis was higher on that side. So we'll often have someone stand on the step, always at the bottom of a set of stairs. I wouldn't do this at the top of a set of stairs, and hold the railing, or you can use any kind of stool or exercise step that you have. Anything where you can step and dangle the left leg and hold on to something to stabilize. You want the leg to go very easy. You're not trying to do a strenuous back and forth. You're trying to get the muscles to relax and let the weight of the leg just kind of pull the pelvis down on that side. So with her, it's just maybe 15 or 20 seconds, just a gentle back and forth. And the way the leg will ease the pelvis back down into an even alignment. All right, so now we'll talk about the way to address if your pelvis is rotated and it has caused a leg length discrepancy. For Simone, we just fixed a left upslip, so she had a shorter leg on the left and a longer leg on the right, and the pelvis was higher on the left. We fix it in standing. If we check the person's pelvis and the left leg is shorter and we find that the pelvis is actually lower on the left side and not higher, so in other words, the pelvis has gone seemingly down in reference to the other side, the foot has gone up, they've gone towards each other. What happens is that could be related to a rotation. So when someone has a rotation of their pelvis, then we need to address it a different way. Dangling the left leg off of a step or pulling on it doesn't correct that kind of pelvic obliquity, as they're called. We find the pelvis has gone in the opposite direction, so we need to do something called a muscle energy technique, which is your muscles pulling on the pelvis to level it out. So for example, a very common one is a left leg that's longer and a right leg that's shorter. We find on this side, the left leg being longer, the pelvis has gone up, away, and with palpation, we could palpate the back of the pelvis to confirm that it is a rotation. The left being higher in the front would be lower in the back compared to the other side. We have a couple of different ways. Sometimes it's easy to correct. So the easy way, when it works easily, would be to do this. So we have, again, the left side of the pelvis is elevated. We want to pull it back down. So we're going to have Simone bend her knee up like this. And then she's going to take her hands and put it right on the front of her knee and try to push really hard to get her knee to go down. So both hands over here. If we do that by itself, we're probably not going to fix it. So we have to do something on the other side. We have to do the opposite. So Simone is going to bend her knee and she's going to dig her heel kind of in. So she's trying to pull her heel towards her bottom using her hamstring. So I, as the therapist, will test that. Pull your heel in like that. Yep. So when she's learning, she's going to pull hard that way. She's going to push down. So she's pushing here for maybe 3 to 5 seconds, 3 times. And then afterwards, we're gonna do our bridge again. Bridge your hips up, back down, bring your legs down straight to see if her legs are equal. If they are, we always check the pelvis though to make sure that the pelvis is level, because sometimes the legs could be slightly to one side or the other, making it seem like it's fixed or not fixed. The pelvis will tell us. The other way to address this, if that doesn't work or someone has trouble with that technique, we'll use a stick. We'll say Simone had the left pelvis was elevated, the right pelvis was down in the front, her left leg was longer, her right leg was shorter. So with the pelvis and the foot going away from each other, we're trying to get them back to level, which would be a D rotation. So for the stick, we're gonna go over the top on this left leg because this side was higher and under the bottom on the right. So what we're doing with the stick is giving a place for the leg to push against, both directions opposite at the same time. So Simone needs to hold it. She's gonna push down really hard here and lift up really hard here. We maybe do 3 reps, holding 3 to 5 seconds. I like to mix it up on maybe the last rep, maybe do like 50 to 75% effort. And then we take the stick out and then she's gonna bridge, put the legs down and check. And those are 2 ways to fix a rotation. I do have one more additional way. Sometimes it's very stubborn and the pelvis won't correct. In that case, to fix the same rotation we were just treating, where the left pelvis is high, the right is low, and the left leg is longer, would be to get right to the edge of the table over here. She's gonna scoot way over. Left leg is gonna be down. She's gonna grab her right knee and pull it with both hands. She's gonna pull it right towards her stomach. This is really helping the pelvis on the right side go back up and the left one go down. We can even do a little bit of overpressure on this leg, or she can kick into my hand. Go ahead and kick a little bit. Yep, pushing into my hand. That's using the quadriceps muscle in the front, which attaches to the pelvis. This is the rectus femoris. Pulling the pelvis down on this side while we're stabilizing on the opposite side. You could even do this where if it really wasn't working, she could use her hamstrings over there. So I could do this and she could do a kick over on this side. A patient could do this themselves though, hold the leg again. If they put a chair or something down here to push their foot against, something to get the pelvis to derotate.